Ladies and gentlemen, welcome to a new podcast. Today I have in the studio with me a special surgeon. He's a vascular surgeon with 25 years of experience between the UK, Germany, and the UAE. He's a lecturer as well. He speaks 7 languages. He does international workshops, and he claims that whatever he does, nobody else does it the same way. Let's welcome Dr. Ashkan here in the studio with us. Welcome, Dr. Ashkan.
Thank you, Danny. How are you?
I'm great. Thank you very much. What about you?
I'm great.
We're going to use one language in this podcast. Yeah.
Okay.
Later on, we see about the other 6.
Sure.
Dr. Ashkan, welcome. Let's just mention that you are currently seeing patients at Swift Day Surgery in Jumeirah near Mercato Mall. We're going to discuss today with you varicose veins. What is varicose veins?
Okay, varicose veins, actually, everybody thinks that it's a cosmetic problem, but in reality, it's a disease. It's a chronic disease, which we have it inherited from someone in our family. It can be partially cosmetic, but it mainly can be medical. So it's a medical issue that we suffer from, but unfortunately, we don't know much about it.
Whom do you invite to visit you? Yani, who should go to a vascular surgeon to check about varicose vein?
Let's correct the question for everyone, right?
All right.
So first of all, we'll say man and woman. Let's stick on this.
Man as well.
Since it's a genetic problem, and the possibility is the same for man and woman. Lifestyle can affect, so ladies get pregnant, so they can affect the veins more, and the guys, they are lucky, so they don't get pregnant.
Thank God.
Yeah, they get it later, at least for now. Okay, so that's the first thing, that it's genetic, so everybody can have it. We advise everyone to check because 50% of population have vein issue.
50%.
50%. From the 50%, only 30% they require any approach or, let's say, more serious treatment. But the other 70%, they suffer from the disease and they can prevent it, they can control it if they know about it.
Uh-huh.
So we don't go within the old style that we were saying that damage your vein, destroy them, then go get it treated. No, now we say no. Check it. Make sure that they're in a good condition, or you know how bad they are. So accordingly, you will change your lifestyle and you're going to take care of it. And even if you find it damaged for a bit or a pieces, you need to treat it as soon as you can because then you will protect the other veins.
What are the symptoms that someone should feel or see so that he comes and check?
So we'll start with the seeing because everybody expects that if they don't see veins on their legs, they don't have varicose vein.
Okay.
And that's not true because 30% of people who have vein issue, they have nothing visible outside and the leg is clear.
Uh-huh.
So not seeing doesn't mean that you are not suffering from the vein issue. So we will start mainly with the symptoms. If you get tired after a long day, so your leg cannot tolerate a long standing or long sitting, tiredness, heaviness, cramps at night, pain in the feet, heel, ankle, or calf muscle, changes in the skin. Sometimes you have your leg skin has changed. It's a little bit shiny. You're losing hair. You have spots on your leg. Skin are changing. Wounds which they are not healing on the leg. All of these can be signs of varicose vein. One of the most interesting signs is the swelling. I ask most of the patients, do you have swelling leg? No. But when we look and I squeeze the leg a bit, I can see 1 centimeter of groove appearing on the leg. And they say they don't have swelling. So for you to know when you are wearing a socks or a shoes or a slipper or whatsoever, and when you remove it and you see it marked on your leg, that's a sign of swelling. So that can be a sign that you have an issue and it's good to check.
And they come directly to a vascular surgeon, right?
Advisable.
Yeah. How do you diagnose whether the person has varicose veins or not?
Definitely not by looking alone.
Okay.
So I always tell the patient that looking will never help for us to know what's the problem. We have to check the vein from inside to see the functionality of the vein, and the major problem always comes from inside. So for that, we need to do a proper ultrasound. Uh-huh. Ultrasound is the safest method of examination. We check the vein from inside and the function. The major point is to do it properly because ultrasound takes a lot of time. I do it personally myself. It takes me around 30 to 40 minutes now after I've been doing that for the past 15, 20 years.
Uh-huh.
Before it was taking me more than an hour. Okay. So now I do it within 30 to 40 minutes.
Why does it take you that much time?
Because you have to check everything. You have to check every single vein in the leg, from top to bottom. You cannot just go one point, say,
Oh,
oh,
okay.
it's okay here. You cannot judge, let's say, the book from the cover.
Yeah.
You go up, you check, it's fine, then it means it's fine. No, sometimes the vein and the top portion is fine. You come a little bit down and it's damaged. Sometimes it's the opposite. You have the top portion damaged, you come down, the
I
rest
see,
is
yeah.
fine. So you have to do a proper checking, because if you want to have a good result, you have to check all the veins one by one all the way long.
Now that we have diagnosed the varicose veins, what kind of treatments do we have?
If after the diagnosis we understand, is it a medical issue and it's very progressive, so
Okay.
that means you need a intervention,
I
let's
see.
call it. But if it's not that progressive or in that bad stage, maybe some small lifestyle change, sometime compression socks and medication would be enough for a
Okay.
person to live many years.
So
in future.
intervention is not in all cases.
Definitely not. Only 30% of my patients I end up with intervention.
When we say intervention, we mean surgical intervention, right?
So now that's the different point about the treatment.
This
Yeah,
is what
that's
you
a
do and
history.
others don't.
That's the history. Yeah,
Okay.
history is the surgical intervention that we've been doing. Maybe I did it 20 years ago. The past 18 years, I haven't done a single surgery.
Okay. And what do
For
you do
surgery.
then? How do you treat it?
There is no one treatment for everyone.
Okay.
We have to modify the treatment according to the patient. So we check the veins, we look at them, see how they are, number, size, location, and according to that, we will plan a special treatment for that specific patient.
Uh-huh.
So it cannot be that two brothers comes, you did for my brother this, but for me you're doing this one. Yeah, of course, it will be different as per person.
Although it is hereditary, but each
Of course.
one can
Yes.
have a different treatment.
Yeah. Even the same patient, one leg and the other can be different.
The main treatment, as we know, is the surgery, right?
So as
Other
I
than
said,
the prevention.
let's say the intervention. So the intervention can be the old method, which is surgery,
Okay.
which I have stopped doing for many years. It still has been done in many countries. Even here, we can find a lot of doctors, they do the surgery, which is very aggressive. It's done under general anesthesia, cut up, cut down, aggressively remove the full vein. So the patient has a lot of problem afterward. They cannot walk. They cannot participate in a day-to-day activity for at least 20 days. Now, the new technology are multiple devices, multiple techniques. It can be laser, radio frequency, glue, foam, steam, ultrasound, microwave, multiple methods we have, which we can use to close the vein instead of removing it.
The one you use at Swift Day surgery nowadays.
Mainly, I like to do the laser, but of course, I have also other devices and other technique which I can use and combine them with.
Let's speak about laser. I've heard that laser is for a certain period of time, and then the varicose veins come back, and then you need another intervention. What would you say in that case?
Definitely not true. Because if you do examine the vein properly and you don't miss the damaged vein, and you close all the bad veins that the patient has, so it means you do proper investigation, a proper treatment, apply the proper laser with the correct device, take your time, do the job well, follow up the patient after that, then that vein will never come back, and the other veins will not go bad on them, because the vein to reach a stage that I would tell them that they need a procedure, it would take 10, 20, 30 years at least. So the other vein that we say they are okay now, it will take them another 10, 20, 30 years to get damaged.
I see.
So we don't expect them coming back so soon.
I see.
By that time, I hope I will be retired.
Speaking of the devices, are there certain devices that you use for laser?
Of course.
Okay.
There are multiple devices, different production, different manufacturer, different fibers, different setup, different waveforms. There's a lot of stuff.
Okay. And in this kind of treatment, do you need an operation room or surgery room, OT, operation theater?
In some countries, they do it in the clinic, but I prefer to do it in the operation theater because it's more clean, more hygienic, and more safe for the patient.
So at Swift, you can do this
Yes,
thing,
of course,
and
it's
you
a
have an
daycare
OT.
surgery. Yeah, it's a day
You have an
surgery.
OT, so the
Yes.
patient comes and does everything at Swift itself. You said that the anesthesia is the difference between both.
That's
right?
one of the difference, yes, because I do it under local anesthesia.
Okay.
Only the area that we are working will anesthetize, but the surgery is done under general anesthesia or spinal anesthesia.
What happens after the surgery, like the laser surgery, the one you were doing? What is the patient? What should he be expecting?
Walk in, run out.
Directly?
Yes. They don't run, they don't go.
Okay, they come back. Eh?
I don't let them go, they have to run.
All right. And how long is the surgery?
It depends. Sometimes it can take 10 to 15 minutes. Sometimes it will take 1, 2 hours, depending on how many veins they have, how many side branches they have. So
And they go home on the same day.
everyone leaves at the same day.
Excellent. Yani you are recommending laser surgeries, laser intervention better than the traditional surgery.
Definitely.
Okay. Is it possible that these varicose veins come back after some time? You said no.
As I said, no. If it's done properly, it doesn't return.
It shouldn't. Is there any change in the lifestyle that the patient should go through after the surgery?
Look, the change of the lifestyle we recommend everyone, because varicose vein is a genetic problem. So if you have the genetic problem, you have to take care of it. Yeah, if you keep on pushing the veins that are weak by themselves,
Okay.
you're going to damage them in a long run. So that's why the recommendation is not related to the procedure, it's related to the person who has vein issues.
Excellent.
The
And-
surgery will only require you 10 days of off doing sport or having a flight, and that's only 10 days.
That's
But
it.
you can go back to work the next day.
And this laser is minimally invasive, we
It's
call
minimally
it, because
invasive,
it's not surgical. An advice from your side to our viewers who don't know that they have varicose and they might have it.
So if you suffer from any one of these symptoms that we already talked about, the tiredness, heaviness, changes in the leg, or let's make it simple. If you have serious issues with your leg or any issue with your leg and it's not fracture or something, so visit the vascular surgeon to make sure that they are in a good condition.
Dr. Ashkan, our viewers who would like to consult you, they can find you at Swift Day Surgery in Jumeirah next to Mercato Mall, right?
Yes.
We're going to mention the number and the website just for those who feel that they have any of the symptoms you have mentioned.
Okay.
Thank you very much for being with us, for sparing the time to inform us about the varicose veins. I hope our viewers have benefited from the information given, and I thank you again for being with us.
Thank you for having me in. That's
Thanks.
great having me.
Ladies and gentlemen, I hope this podcast was informative for you. We'll see you in other podcasts. Thank you very much.